Rosemary, if you can talk everybody through what you sent on the thing first of all, and then we can all understand what we're going to be discussing.
I wonder if I should just read it out.
Yeah, read it out. Right.
Okay. All right. So we've got a client called Diane, 39 years old. She has type 2 diabetes, anxiety, and right hip pain. And this is written from her point of view. Why does he have to say please like that? It's so fake. I can literally feel him twisting my insides when he does it. His please is no please. It's an order disguised as a please. Just like Mr. Herman did when I was in year 3. He hated me. It was awful at home and at school. That's when I started biting my nails. I should snap out of this and get this photocopied like he said, or I'll hear that please again. There's Annie. It was good of her to cover for me yesterday when I went to see the GP. My HbA1c has gone up again, and I'm still officially diabetic. She wants me to start metformin now, as I've been putting it off for 9 months, but I've heard I can reverse this, and I'm determined to. I just haven't got round to it, but I'm starting today. There's been so much going on, and exercise is difficult with this pain in my hip. Dr. Rana says my x-ray is okay, and that exercise and losing weight should help. Catch-22. Just my luck to land up with a boss like Ben. He really riles me up all day, and I think he knows it and does it on purpose. I feel constantly on edge now. If I didn't have to pay back my credit card debt, I'd have found another job by now, even if it pays less. Ah, the photocopier. And Krispy Kreme's next to it, assorted, for Joe's birthday. I brought an apple for my snack, but I feel so awful, I think a nice cup of tea and something sweet will help. I'll have a plain one instead of one filled with jam and custard. Yes, I'll start tomorrow for sure. So Diane exhibits, just the way she speaks is so in her head. You can just kind of hear her thoughts rattling along all the time. And so what I feel from her is that she's got this anxiety, which she hasn't mentioned speaking about with her doctor. And she's got this overlay of diabetes, which she has spoken about with her doctor. And this job and what she's describing with her boss is firstly irritation with him, but that her interaction with him is actually triggering something or an experience that she had as a child, that she's still in a survival, flight or fight relationship with. And so in order to cope, because she's got life stuff going on, she's got credit card debt. I don't know if one of her soothers is shopping, but certainly she likes a sweet treat. And although she has these good intentions to change her health and is actually refusing medication from the GP because she wants to so much, she's really having trouble with getting started, knowing what to do. And when she gets into stressful situations where her nervous system is activated, she turns to what she knows best, which is sweet treats. And so as an NHS GP, I would have 10 minutes to see her. So I would do what Dr. Rana does, which is to say, your HbA1c is creeping up. We've been waiting 9 months for you to change things. You haven't changed things. Is it time for medication now? And obviously, I wouldn't force her to take medication in the same way Dr. Rana hasn't forced her, but I would be asking her, how long are we going to wait for things to turn around? And in terms of medication that's available on the NHS, it would be medication such as metformin, gliclazide, and maybe even insulin if things weren't turning around with the tablet medication. She would also be able to be referred to community well-being services such as Be Well in Manchester for a period of 8 weeks or so. And people do feed back good things about it, but I don't know how, or if the intensity is enough to keep the momentum up for some people. But I think it's fantastic that we do have those services in the NHS. They can be difficult to get into, and their distribution can be sporadic as well. It depends on which postcode you live in. And then with my health coaching hat, and with more time, I would definitely delve more into helping her to understand how her behaviors are linked to the trauma that she experienced as a child. So this little T trauma, and this is just one little T trauma she's told us about. We don't know what else has happened. And help her to see those links and help her to see how this person is actually giving her information about something within her that is bringing itself up to be healed. And in doing that and in integrating that part of her, that year 3 part of her that is still quivering in a corner afraid of that teacher, that she might find that that comes with a lot of gifts, and because it's healed doesn't necessarily reach for the sweet treats or whatever it does to soothe itself, and that could have a huge impact on her HbA1c in and of itself. But she could also find that the other things that it contributes to her in terms of the reclamation of her power and her sovereignty could lead to her taking up an exercise program or finding it easier to do other self-loving, vitality-enhancing behaviors. So I'm going to pass it on to Isabella now and see what she has to say. You're welcome.
So I made a load of notes, many of which, with which I concur, Okay, I thought I'd just approach it from this perspective. I mentioned earlier that we want our health coaches to have a broad health knowledge, and that's not just for physical issues but for mental health as well and related. One of our standards is trauma-informed coaching. So I've written on this vignette trauma ? Around Mr. Herman and what he did or didn't do to show his hate in year 3. There's clearly stress and anxiety going on. The blood sugars going up can be, stress has a big part in that, so it may not just be her diet. In fact, it has a huge part. We don't know anything about her sleep. She wants not to take metformin, hats off, but she hasn't got around to doing the things that she thinks she ought to have been doing, presumably diet and exercise. There's been so much going on. So there's procrastination and maybe some denial there. As you've said, the cup of tea and the nice snack is self-soothing. She'll have a plain one instead. I've put good start, actually. A plain one instead of one filled with jam and custard is a good start. I mean, it's a start. You've got to give credit for that. I'll start tomorrow for sure. Now, as a health coach, I wouldn't be raising these issues with her unless I had another scope of practice, an additional scope of practice. What I would be mindful of is in the conversations with her to be looking for any evidence that she might, any clues that she might be giving through what she says or she doesn't say, to help me understand the bigger picture. As a health coach, I would probably take her right back from that and say, ask the question, why? What is it? You're clearly concerned about your health. You have a health issue. You're clearly concerned about it. You want to do something about it. You're finding it frustrating that you can't make any progress, or you're not making the progress that you emotionally want to make. Let me ask you a very simple question. What is it that you want your health for? What is it that you want your health for? Because that's a question that, in my experience as a health coach, makes people stop and think, and they don't say, oh, because I just want to be healthier. It starts to help them really understand what is the fear of not having that health. Another question is, what would it be like if you had the health that you really wanted? What would life be like? What would you be able to do? So having then given them that opportunity of just standing back and reflecting on what it is that's driving that purpose, that meaning. Have they got purpose and meaning? It doesn't have to be great. It could be, well, actually, I really want to be able to walk the dogs without getting out of breath. I really want to be able to swim without feeling foolish. I really want to be able to get down on the floor and play with my grandchildren and get back up by myself. So that's a start where health coaching can really start to build on what's the motivation, what can we do? And then I think with permission, I would offer some suggestions, not recommendations, but for example, we know that, and I hope I'm right about this, that stress has a huge impact on the psoas muscle. So hip pain can be an emotional, stress, anxiety, the cortisol. That can be an indicator of huge stress. So I might explore with her whether she's ever tried any stress management, and if not, might offer some suggestions of things that she might like to try, like meditation or some of the moving meditation like Qigong. I'd also ask her, maybe, had she thought about Nordic walking poles? Now, I'm on a mission for Nordic, as you know, Richard, because they helped me walk again after dreadful diagnosis and chronic pain. So Nordic walking poles will help people walk through the pain. I would ask her what she knows about diabetes. Does she know very much? Does she know about the different ways that she can approach managing her diabetes before she has to resort to insulin or metformin? So those are but with permission, because my role is not to recommend, it's not to advise, it's to explore, to be by them, but to have that knowledge at my fingertips so that if they want more information, I have it there, or I know to whom I should refer. So if I really get a red flag for deep trauma, I would be referring on.
Hi. Well, you've nearly took the words out of my mouth, both of you, actually. So I'm very lucky because I can test insulin levels, I can test glucogen, I can test the liver, I can test the pancreas. So in that way, I would get some sort of diagnosis in that way. But as you described, you need to look a little bit more into her emotional state. And if she's had an X-ray on her hip, which relates to the gallbladder and liver in Chinese medicine, that's another indicator that the liver's not working and she's not breaking down glucose properly. So that's one way I would look at why she's got a hip issue. And the liver's and the gallbladder's involved in anger and frustration, and she's clearly angry and frustrated. Doesn't really say about what it is, so I think some of this is coming from her childhood. It's really obvious, actually. And with men who have an issue with sugar, they normally have an issue around their mother's absence. With women, it's similar to fathers. So I'd want to explore a little bit about her relationship with her father and the reason why she's like that. Yeah, and her boss is obviously irritating her. So I think there's some good father information there from a psychological point of view. And if she has a sugar issue and a liver issue with this, then I would say her hormones might be a little bit imbalanced. So I would want to test her estrogen and progesterone to see whether that's functioning properly, because her stress levels can be high if they're imbalanced. And obviously, if there's a history in the family or not. Then if there's no history in the family of diabetes, Then I would look at environmental causes like pollution and chemicals and things like that. And there's a whole range of medicines I use, like noni tincture, walnut tincture, barberry. There's a whole range of things you can use for her liver, and there's a lot of Ayurvedic medicines for her hormones that I use. One of those is a Shatavari, which is a beautiful hormone for the mind and progesterone and estrogen balance. And yeah, I think we've all covered virtually there's psychological issue. Actually, I'm not completely against metformin because I think it's an anti-aging drug, it's anti-cancer, and it does regulate blood glucose. What I've found interesting is 1 in 10 people who take metformin, they end up being B12 deficient, and I understand the reasons why that. So I'm quite lucky in understanding those sort of things. So yeah, holistically and treatment-wise and medicine-wise, I'd be looking at the primary issue to see whether it's a psychological primary issue or whether it's purely a stress issue or a liver, pancreas issue.
Thank you. Yeah, wow, we're all singing from the same hymn sheet. I think the first, can I just take the paper, please? The first thing I noticed about this particular client, where is she? There's just this sense of this what's the word? Like testiness to her. And when we think about testiness, I don't think, is there another word for being testy? Anyway, the opposite. It's kind of like impatient and wanting to meddle and wanting to. There's just that little energy about her, and I'm curious about the other side of that. I believe everything sits on polarities. So the other side of testy is like there's a real strength of resource, of abidingness, of knowing direction and being in a real strong path. So it's interesting that she's displaying this sense of testiness when it could be that the other side of that is a real power of steadfastness, and she might actually have a real gift to share with the world. And I think going back to the idea of trauma, when you consider the trauma that potentially is held in the right hip, so you think about the left and the right side of the bodies, the right side represents the masculine, the hips like the security, the foundations of who we are. So we've got this imbalance on the right hip that could be all connected with this testiness that she's stuck in. She also feels a bit like, I studied Alan Bennett back in school. She feels like one of the characters in there anyway. Very typically English, and also like I get a sense of like I think sometimes, there's no nice ways to say this, but sometimes people thrive on their complaints as well. It's like it gives them an excuse, a reason. She's kind of displaying. I won't obviously be so pokey and tell her all this, but I'm in the back of my mind, I'm thinking, is this who this character is? And if somebody's got that kind of edge to them, then are they gonna potentially not? Well, she's already showing that she's not sticking to the no sugar. She's got an opportunity to prove to herself, and she's not taking charge, she's not taking responsibility. So I just wonder how much secondary gain she's gaining from actually being in this position. And we can all probably reflect on, if we've got a bad back, does that get us out of doing the gardening or washing up or whatever else? Does somebody come and help us and look after us when we fall? And it sounds as though this woman's single. Are we? We've not got that far. I'm just tuning in. I'm just assuming so. So I definitely think it's she's single. Yeah, thanks. I also think agreeing with Isabella with the psoas muscle and the right hip. For me, I might take all of this information and not say a word, but let my hands do the talking and start working at seeing if the body will respond to the touch, will respond to the change. If I see that change and she comes back the week after and things have changed, she didn't need to know any of the thoughts that I'm having, but it's almost like I'm staggering thoughts of like, okay, maybe next session, if we're not getting that improvement, then I'll pull that one out of the bag. Or the next one I might then, and then 10 session in, I'm going to really consider asking her how much she's benefiting from this pain, you know, in a really compassionate way. So many clients, when they hear that in a compassionate way, there can be the floodgates open and they're free of it because they've realised, oh my gosh, I'm the one that's holding me back. There was something else as well. And just something around diabetes and, you know, what's the issue with sweetness? If we can take it down to that, if we can take the message from the disease, what is the sweetness that they're not able to accept in their life? And she's kind of demonstrating that in the slightly antsy, slightly testy. Bitter, yeah, that's a good word as well. I like this woman. I feel like she could be a really lovely client to work with, but just this undertone and this edge that she could transform and that she could have some real purpose and I keep saying this word, elixir to give to society, you know, if she's in the right hands. There you go. No, you've got
one. So coming from an internal family systems perspective, kind of what stands out for me is, you know, using the body, using the right hip pain as maybe what we call a trailhead, and just giving it some attention and some awareness and just being curious about it, like openly curious and seeing what messages are maybe stored there in that side of the body. She said, you know, the right hip, maybe there's some imbalance, maybe there's some, you know, hidden messages in there for her to hear. But also, you know, the anxiety as well. And this thing that's going on for her with the boss, you know, she's clearly frustrated and there's some maybe even anger there. And for me, I don't know if you get this well, but sometimes like anger can often be the truth teller of the system. It's telling us like something's not okay here. And she's got great insight, you know. She says she's referring back to just like Mr. Herman did when I was in year 3. So she would have been about 8. So she's seeing a pattern here that's maybe playing out in present day that she experienced when she was 8. So I'd get really just curious about what she knows about what was going on for her when she was 8. And just reading that as well, it was just like so much compassion for it. It was awful at home and school. Like as an 8-year-old, you spend pretty much, that's your life, you know, home, school, playing out a bit. So there's no kind of safe space for her. And again, she says it later on. Where is it? When she says, he really riles me up all day. It's like all day she's in this kind of state, you know, of there's no space for these parts of her that are being activated in her job. So that'd be, a good trailhead to get curious about. And I'd also, what's really interesting as we're talking about healing, particularly kind of things that are showing up in the body, I'd get really curious about any beliefs around healing, because there's some kind of avoidance or procrastination going on. And like because she says as well something about, I've heard that I can reverse this. I'd get curious about parts in her. Do all her parts believe that she can reverse this? Or are there some blocks there to healing? Maybe there's a part of her that's like, I don't know, your beliefs around, I'm just a sickly person, that's kind of who I am, or I don't deserve healing, or it serves you right for eating all the sugar. So just to get really curious about any beliefs and burdens that parts are holding around healing. And kind of just get them on board, seeing where those beliefs have come from. Are they hers? Maybe we talked before, I heard you talking before about, generational trauma and where these messages came from. And just kind of updating the system and building this sort of self to part and part to self relationship, because she's got that insight. She knows there's something going on here. So I'd really build on that self that is in there. We know it's in every single one of us, including Diane. And I think that fit really well in what was shared before, like, what would it mean for you to heal? What do you want to do? And kind of getting different parts perspective, because these parts of us have got self-energy too. So just tapping in more and more and having more and more access to herself would be, I feel, really, really helpful. And once she starts accessing that, there'll be more compassion for these parts of her that seem a bit stuck in a cycle. And something that really stood out to me was just my luck. That really stood out. It's just my luck to land with a boss like Ben. And kind of, is there some sort of self-blame, or I'd get really curious, whose voice is that? Where's that message come from? And to maybe shift that perspective that you, Christian, you were talking about before, like that is the perception shift of actually we can use what's going on here for Diane and doing that U-turn for healing that elixir, and unburdening the system, giving her more joy, more freedom, better health, more mobility, whatever she wants. But just using things as a trailhead. They're like little clues, aren't they? Like little, saying someone before, little cookie crumbs, and we're following that trailhead. So that'd be the way that I'd approach Diane.
Well, I'm scraping the bottom of the barrel now, aren't I? Thanks for that. And I didn't get the email about Diane, so this is no. So I'm fresh out the starting blocks, but that's fine. So some of you have attended my Alpha Stim workshop today and maybe sat expecting me to talk about Alpha Stim, but I'm just going to put that to one side. It's going. What most of you won't know about me is I work extensively in my own practice as a coach using horses as equine assisted therapy. And what I've learned through working with my horses is that they see the truth behind everybody's mask. And when Rosemary first started talking about Diane, the first thing that came to my mind was, do you remember as a child you played a game, Pass the Parcel? And there were many, many layers of paper wrapped around whatever the object was, the prize at the end. And I kind of see Diane, like so many of my clients that have lost the identity of what that diamond is in the center. And she's, over the years, have wrapped so many layers around that innate wisdom, the diamond that she is, that she no longer recognizes herself. And so whilst I understand the different medicines and the IFS and the coaching and the nutrition and bioresonance and everything else that we can do to help, my approach would be to introduce Diane to my herd of horses that would take off the veil. They would take off the mask. They would take off all the layers that she surrounded herself with, without judgment, without prejudice, and she would find her identity again. And once she finds that place and accepts who she is, then she can start to heal. Because as we've already discussed and agreed, we all have an innate wisdom and ability to heal from inside out. We don't always need something outside in to assist. And so that would be my approach. Now, we also need Diane to be calm, focused, and able to listen to information that we're giving her. And that's where the Alpha Stim that some of you have experienced today does help. And I do actually use that with my horses as well. So, that would be something extra that we can add that just gives her an opportunity to just be quiet in the mind and stop creating layers and layers of thought and processing her traumas and her experiences, the journey that she's been on, and start to see that as a gift, that what she's experienced is just who she is today, and it's part of her life, and she should celebrate that and not use that to identify with trauma, illness, diabetes, and start labeling who she thinks she is. So that would be my approach. It would be, come and talk to my horses, spend some time with them, and they will reveal to you the truth. And that is a good starting point. That gives her back her foundations of who she is, where she came from. And they don't look at you and go, you know, I don't care if you're fat, thin, black, white, yellow, pink, tall, small. They couldn't care less. They go off your energy and your truth and who you really are, and they don't suffer fools, you know. They know the truth, and they will reveal that for you. And that would be my approach to Diane. And then I would hand it back to these guys, and they can start giving her the knowledge and the information that she's not quite hearing. Because knowledge is there, isn't it? We all have the knowledge. You can go on Google and find the knowledge. So if it was that simple, why are we not using that? Why is she in that situation when there's so much information? And it's because she's not identified with who she is. She's a diamond inside so many layers that you can't penetrate those layers until she finds that center. And that would be my approach.
Hi, I'm just curious, has the panel ever come across 1.5 diabetes, also known as LADA? If so, have you treated it with anything that isn't down the insulin route? Because I know that's really popular. And have you had any success with intermittent fasting and LADA? And I realise it's quite, it's not that well known, but I'm just trying to find as much information as I can about it. Thank you.
So I've read about it in letters from consultants where we've referred patients to the diabetes clinic, and they do tend to use insulin for them. I haven't come across it in my functional medicine or health coaching practice. I can't see how intermittent fasting wouldn't help. I would only say that if a person is on insulin, then you'd have to be really careful about hypoglycemia and having low blood sugars. And so I would do it very gently, keep very good tabs on what the blood sugars are. Do you have a Zoe or a... no. See, that would be ideal, because then you've got that constant blood sugar reading. I know you can get them privately and pay for them, even if it's just for a couple of weeks, to start to get an idea of what your blood sugars are. But I would definitely, being on insulin, if you are on insulin, just go gently so that you don't end up on the floor. Yeah.
I did a talk on processed foods about 4 weeks ago, and I wanted a volunteer to test, and I did a demonstration in front of 40 people. And the lady that I tested was about 40 years old, and she's on insulin, but they still can't control her blood sugar. So she's coming in to see me in about 2 weeks' time. And what I can do for you, if you want, is when I tested her, there's no history in the family of diabetes, so I was intrigued to find what might be causing it. And I tested her. It was only a 5-10 minute test, that's all. And I found that she had an environmental chemical in her pancreas, and that was causing her pancreas to be really, really high. They can't control it with insulin. So I've asked her to come in because I said, well, if there's no history in the family, you must have got this from somewhere, diet or lifestyle. And basically she said she worked in a paint factory for 7 years and smelt the toxin. So if you like, I will do a bit of a case study on her and treat her and report back to you if you want, because they can't control her insulin even now.
I was getting a little bit confused about our patients self-referring themselves to any of your panel, or if, as in needing to identify who she is through hypnotherapy or NLP techniques, or is it our professional guidance when we're aware of all the modalities that we could reach out to the patient with. Does that make sense?
Do you mean internally amongst? So I have a bit of a rule of maybe 3. If I'm working with a client for three sessions, I want some reasonably significant, good enough outcomes to start emerging at that point for me to see that there's a constant. And if I get to 6 and it doesn't seem to have got beyond what I achieved in the 3, they're gone. I'm going to find the right therapist for them. But in those 3 sessions, I've started to understand more about how they operate, how they work. So I have an opportunity to either refer by writing something that this client can take to this other practitioner, or with permission I can get on the phone to said therapist as well. And with an understanding that they kind of feed back. I think that's the key. It's that it's not just about gone, it's about find out what, and then actually that, because that practitioner that I've just referred to also understands where I come from, and we just get to work with more people and be the right practitioner in the moment.
And it would be really nice as well if all GPs knew about all these things, wouldn't it? It'd be amazing. I think I'm going to take one more question, and then because we've overrun anyway, so there you go.
Hi there, thanks for all the insight today. I do have a question around accessibility to people on low incomes or no incomes and poverty, and everything we've heard today is amazing and incredible, but it does come at a cost, and it's not free at point of access like medications on the NHS to an extent if you're on a low income or on certain medications. How do people access help when often the poverty and the lifestyle that comes with that means that people are unwell and have long-term health conditions, pain, diabetes, all these things that you know way more about than I do, but it is not accessible to people who are under the radar to an extent.
And that is probably the best question to finish on, because that brings everything together. And I'll tell you for why. Because some of the things that we do here at the monastery, we do a lot of things that are free of charge. But I completely get it. And this is conversations that, I've worked with Christian for 20 odd years. This is conversations we've had so many times over the years. Because, we're all private practitioners. we all work privately, so we have to make a living. And it is about, some people want to earn a lot of money. Some people are quite happy to earn a nice living from it. But there is always that cost. What we are trying to achieve at the monastery is to create a service that is free. And that service will be provided by practitioners. We train sports therapists, soft tissue therapists, massage therapists, we train health coaches, we train nutritional therapists who all need case studies. And we offer supervised case studies. We've got we've got the listening service. We've got all sorts of stuff. We've got so much, advice that we can give, that we can steer people to the right place. Lots of charities that do things. What we found is there is always something available, but it's that person, the end user, trying to find that. And that's what we're trying to create. And we are creating it. And we're not the only people. There are, Isabella said earlier, there is money available. I think it might have been Isabella or Elaine. There is money available. There's so much money floating around that we can use for this. But it's finding it, and then it's getting it to the right people, instead of people jumping on it and then, I don't want to cause any problems, but paying huge salaries and then not delivering a service. We're trying to change that model. No, we're not trying to change it. We are changing that model. We are bringing in so much things. As Elaine was saying earlier, from Sunday to Thursday, there is something happening here every single day. So, if people can get here, there is something going on. We're setting up something with our health coaches, with our nutritional therapists, with our soft tissue therapists, because we've literally pretty much just moved in. And part of that is because of this. This is what we want to achieve. We want to achieve that, what we're doing is accessible to everybody, because there's always going to be people there that are willing to pay. And that will fund everything else, we hope. So I think, that it's a really valid question, and it's a good question. Like I said, we've been having this for years. And the thing is about, complementary therapists, any therapist or coach working in private practice, I will guarantee that the financial thing is always a thing that gets them. At the end of the training course, what do I charge? I don't want to charge too much, but then I've got to make a living from it, and I've got to pay for my training. There's all sorts of things that come into it. But there are so many people that are losing out. We get that. There are so many people that are literally just having to take paracetamols because they can't afford to get somebody to look at their problem. And they've got, a huge waiting lists. So this is what we're developing. And I think we will be the first organisation to roll this out. There are others that are looking at this model, but I think we're going to be the first to roll it out. And we're in a really fortunate position that we do have a lot of students that we can provide, a free service, a really good service, because they're at the point where they're amazing. They're just starting, but they're still amazing. It's not, a second-rate service. It's all supervised. So I think that is the start. And then again, I think, what we were talking about before with the NHS and GPs, if we can show that this is working and there's a real need for it, then hopefully, and we live in hope, we might see something, more broadly kind of rolled out. But I think it is going to be down to organisations like this. And so the Monastery is doing that, and hopefully we'll see other establishments and organisations rolling that out as well. Does anybody else want to? Rosemary?
Thanks, Rick. So I'm just going to give a little flip side to that as well, just for a bit of balance. So as someone who comes from a country where there's no free health service, I feel that the NHS is an amazing structure within the culture of the UK. But that there is also a conditioning that comes with free healthcare that means people don't feel that they should invest in their health. Money is a form of energy. Everything is energy. And we're asking people to do really hard things, to ask someone to not have the Krispy Kreme and have the apple instead takes a certain amount of activation energy to make the choice when they're both sitting next to you. But if you have paid something means-tested, something not exorbitant, but you have already put some of your energy as almost as a matter of belief towards your healing, then that push, because money is a very interesting thing psychologically for everyone, and if you have made that little push or that investment, it will make it more likely that you will choose the apple than the donut because of the investment that you've made. And so if that means not buying a pack of cigarettes twice this week so that you can pay for your appointment, then that's already changing long-standing patterns of thoughts and behavior and conditioning. And so I love the NHS. I love that it's free. I see what happens in America where people end up in huge amounts of debts. I see what happens in Zimbabwe where people can't access treatment at all. But there is also a sense of empowerment and taking your life into your own hands when you start making choices using money as the energetic currency that can really propel your healing. So.
I just like to maybe make a comment from a slightly different perspective, and that is...
No, carry on.
Am I right?
Yeah, I'll take this in a second.
Community. Community is the cure. Community is medicine. So I think we don't value our communities enough, and those of us who are less fortunate and live in circumstances where, you know, access to healthcare is difficult, access to paid healthcare is impossible. There is a lot that we can do through population health initiatives, which are not just about giving yet more information. You know, when the reading age of our population, the average reading age is 7. You know, and people with with a second, where English is a second language, or they have some other learning disability, they are not able to understand that information. Even those of us that are educated, when we're given health information, the mind shuts down and we're not listening, we're not processing. Communities have always looked after their own. And I think from a health coaching perspective, and I'm not talking about, clinical or therapeutic interventions here, but simply that sense of building, that sense of community, that sense of empowering each other in that community to share information of what's worked for me. So we might be looking at chronic pain, we might be looking at issues to do with diabetes or obesity, and how can I lose weight. Health coaching, health coaches can play a huge part in facilitating those conversations in communities. I've done it myself in South Birmingham, huge Asian population, South Asian. They are hungry for knowledge. They want to help their own communities. It is not difficult. It takes that pivot away from creating health centres to creating healthy communities.
Thank you. And we are seeing more and more GPs now turn into health coaches. You know, we're seeing that so much more from what you've heard today. We're seeing GPs doing it. We're seeing GPs train as health coaches because they want to, try and reduce the amount of medication that they're prescribing, because there is usually a different way, not always, but usually a different way. So we are seeing, a lot more GPs getting into it. And again, it's all about education. It's about educating each other. It's about educating us. It's about educating doctors, GPs, health practitioners, whatever. It's about educating them in what is available. That's the whole point. What is available. And there's tons of stuff. And there is money around. We know that. It's just, getting hold of the money and putting it into schemes that actually benefit. But I'm going to close it there. We've only gone over 15 minutes, which is fantastic. So I just want to close it by just saying thank you so much to everybody for attending. I've had such an amazing day, I've got to say. It's been fantastic. It's been our first Integrative Health conference. We've done lots of others before, Christian and myself, and I know Isabella's done lots of stuff, and Dawn's been on stuff with us, and Rosemary's done things. This has been such a really good day, and thank you so much for attending. Thank you for engaging with us. Thank you for joining the workshops. Thank you again for all the speakers today, for all the workshop hosts, for all the team, both Active Health team, the Monastery team, and then all the, like I said, the guests, the speakers, and everybody else that's turned up today. It's been fantastic.